Ahoy, Minnetonka. I'm David Law, Superintendent of Minnetonka Schools. Thank you for joining us for this episode of our district podcast, Ahoy, Minnetonka. Today, we're talking about one of our key goals set by the school board and a critical area of focus for our school district: excellence and well-being, connection, and belonging. In particular, we're going to focus in on well-being and how our schools provide supports and opportunities for our students and staff in this area. Joining me today is Health Services Director Annie Lumbar Bendson and School Board Director Dr. Mike Remucal. Annie, Mike, tell us a little bit about yourself and your connection to the district.
Thank you. Well, I am, as David said, the Director of Health Services here in the district. I am starting my 6th year. Before I was an employee, I was a parent. So I have 2 boys. One is a 7th grader at MME, and the other one is unbelievably a senior at MHS. Both were Scenic Heights kiddos, so shout out to them.
Nice. Mike.
My name is Mike Remucal. I'm a school board member. I was elected 2 years ago in a special election, then got re-elected last year. So now I'm almost all the way through my 2nd year on the board. We have lived in the school district for 12 years, and we have 4 kids that have been either completed their schooling at Minnetonka or are currently in school in Minnetonka.
Great, and you're not campaigning this fall?
I am not, for the first time in 3 years, I am not campaigning this fall.
And that's got to be good for your mental health right there. Well, let's talk a little bit about our mental health efforts going on in the school year this year, and maybe a little bit about what's happening this year and your roles in those activities.
Sure. And I think it's important, that we really can't separate out the two, as well-being impacts mental health and vice versa. And I think also remembering that schools are really a microcosm of our communities. So what happens out in the world is really reflected in our schools. And so we really have a multi-pronged approach here in Minnetonka to supporting students, as there's really just not one path to support kiddos. And there are so many things that could impact a student's well-being, so we really take that multifaceted approach. What I love about this is it really aligns with my background in education as a public health nurse, because we're really focused on that prevention. What can we do proactively to support kiddos? And yet, if that's not quite enough, then we stand ready to serve at the intervention level to make sure that everybody's needs are met.
Mike, you've got a medical background, and when you got on the school board, you dove right into some of these mental health opportunities. What's your role supporting mental health as a director and uniquely aligned to the Mental Health Advisory Committee?
As members of the school board, we all we sit on various committees in the district. And for myself, I'm sitting on the Mental Health Advisory Committee, as well as the Tonka Cares Committee, both of which have, obviously the Mental Health Advisory Committee focuses entirely on mental health. The Tonka Cares Committee focuses on a number of things, involves more community members as well, but also focuses on mental health as well as substance abuse issues. So it has been a great experience for me to be able to use my medical background, my medical training, and bring that experience to these committees.
So for you, you have a passion in this area, but the board has had multiple year commitments to supporting mental health and well-being. Can you talk a little bit about where that comes from as a member of the larger board?
Yeah, absolutely. Before the pandemic even started, we were already having, in the United States, we were seeing problems with mental health issues. And that just got a lot worse during the pandemic. To put some of the recent statistics into context, the Substance Abuse and Mental Health Services Administration performed a survey in 2023 looking at mental health issues for the previous year. If we take that data and apply it to our current high school class, it would mean that in the past year, about 706 students had a major depressive episode, 474 students had suicidal thoughts, 230 students had developed a plan for suicide, and 131 students actually attempted suicide. That's almost 1 student for every day the school is in session. Additionally, the CDC has data that suggests that those rates may even be twice as large as that SAMHS survey showed. And that means that persistent feelings of sadness or hopelessness are occurring in the equivalent of all of our senior class and more than half of our junior class. And these were all increasing before the pandemic. And since the pandemic has occurred, during and after, those numbers have just exploded. Some other numbers that are really important to us: girls are at higher risk for anxiety, depression, and eating disorders, and boys are more likely to die by suicide or be diagnosed with a behavioral disorder. And I think our own surveys have demonstrated that in Minnesota at large and in Minnetonka. And while the risk for dying by suicide is higher for boys, the post-pandemic Health and Human Services data said that 51% of ER visits for suicide attempts, there was a 51% increase in ER visits for suicide attempts in adolescent girls. And of course, Black, LGBTQ+, and other marginalized groups, including socioeconomically disadvantaged students, have rates that are 2 to 3 times higher than those that are outside those groups. So it really is a big problem that we're dealing with on a national scale, but especially in Minnetonka. We really want to make sure that as a board, we want to make sure that our students are being well taken care of.
So those national numbers and surveys feed the board's passion to make sure that our kids are as healthy as possible.
Right, and it's just further fine-tuned by our own internal surveys that we perform every year with the students and the parents and families.
So how often does a mental health advisory committee meet, and what are the kinds of things that happen at those meetings?
Sure, yeah, and just to give a little bit of background, the committee was established right before COVID happened, and so we quickly had to pivot to online meetings during that time. And really, we've been fortunate to have consistent members for a lot of those 4.5 years. So people from the community, parents, providers that have a lens that we may not have in the school. And so there was work that was done through an evaluation through William Dykle, Dr. Dykle, that gave us a big snapshot of the district and ways that we can help support kiddos. So we worked through those recommendations and implemented a lot of changes from that report. And so we meet quarterly, and it helps to just, again, give the lens of what are parents out in the community seeing that we need to prioritize, and how can we support kids, and what are the providers and therapists that are out serving our students? What do they bring to the table, and what can they offer in terms of a plan? And so really our goals and priorities for this year include identifying the needs from the perspective of the community. What is beneficial and needed to support our kids? Prevention and intervention strategies. As we talked about, we really have the most benefit from doing some prevention versus waiting until there's a problem and trying to intervene then. How do we connect families to community resources that are out there to support their students? And then identifying and disseminating mental health related professional development in an effort to support our staff.
So let's go, you went through that spectrum of services. Let's start with prevention. What are some of the ways Minnetonka schools proactively works to support student mental health?
Sure. I think there's so many things that we do on a daily basis that are just behind the scenes, and that includes our bullying prevention curriculum and developing those skills in the classroom of how do you engage to be a good friend, and what is expected of a learner, and how do we manage stress and anxiety. Let's say that we're really nervous about a test. That teacher may, as part of a larger lesson, talk to the students about what can you do when you're feeling anxious and stressed. And so some of those reduction strategies that we just build into the everyday teaching, just kind of on an ongoing basis, is one of the pieces that we do on that prevention level.
All right, and so some of the board goals about social emotional learning, K-12, are the foundation for mental health and mental well-being too.
Yep.
We're doing some piloting at the middle school right now.
Yep.
I think the program's called Be Good People. And will that information get back to the board on how things are going?
Absolutely, yep. So we knew that at the elementary level, we were doing a great job of working with kids to help give them names and identify those feelings. And we realized that that work doesn't just stop at the secondary level and at the high school level. So how do we expand that to ensure that they have the vocabulary and the skills that they need to be successful learners throughout their academic career?
Okay. Transitioning from proactive work, how do we identify who we think might need some more support at school? Is it parent phone calls or staff input?
Kind of a variety of ways. We find out a number of different ways. We may have a parent reach out to us and say, I'm concerned about my kiddo. Or it might be that through information, through our universal screening that we do, that really looks at how are kids gauging how they're doing in terms of their social and emotional health, that give us input and feedback. It might be that a teacher has a concern. And so really that support staff works collaboratively to talk about What are we seeing with these kiddos? Are other staff seeing it? What are the parents seeing at home? And what resources do we have to help support that?
Okay. The next level is tougher. What do we offer in schools, and what's the landscape in the community? And you probably both have input on this.
I can start with that. I think it's important to remember that while we are a great place for a lot of resources, we are not a facility that's open 24/7. So we want to be clear about, and I know that you've shared this previously, is that we want to ensure that parents are equipped with resources because we are not open on Saturdays. So if a student is in crisis, we're really not the place to go. But there's a lot that we can do within the school setting, including, like we talked about, those support staff that help to meet with those students. That could be counselors, social workers, psychologists. And really what we want to do is ensure that parents are connected to the resources that they need so that they have them available at the time that they need them.
And how about in the community? Mike, what's your perspective after being with Tonka Cares or the Mental Health Advisory Committee? Are we building the right kinds of bridges to transition students who need help?
We are. I mean, we're having some difficulty. Everybody in the United States is having some difficulty right now, just because the number of providers is not as large as we would like it to be, as would be ideal. There is enough of a provider shortage that, you know, the providers tend to prioritize for those who are most in need, and a lot of students, a lot of adults, even when they are having just sort of day-to-day problems, they're having a harder time getting connected. So we are doing the best we can. We have direct connections with a number of providers in the community that we can reach out to and connect with students, and help them get in touch that way, so that they have somebody that they can turn to for some of these crisis situations. The other thing that the Mental Health Advisory Committee is working on right now is updating our website, the district website on mental health and well-being, so that families, staff, students can all reach these resources. It will help point them towards those resources that will serve them in times when they're in most need, when they're not in the buildings.
Okay. What's co-located services?
That was one of the things that I was going to add. So one of the things that we do here in Minnetonka is we have a co-located counseling model with Relate services. We were one of the very first adopters to be able to provide in-person therapeutic services while kids are at school. So we've worked really hard to establish and grow our relationship with Relate, and happy to report that we have therapists in each of our buildings that serve those students that would otherwise maybe go unserved. So what we're really trying to do is meet those kids where they're at with their needs. And they might not be able to access services outside of school for a variety of reasons. There are a number of barriers. So the Relate therapists are on site to provide that necessary and needed therapy during the school day.
Okay, we've talked about something that hasn't been covered today. What's a JED Foundation, and what does that have to do with our mental health efforts and supporting our students?
Sure, absolutely. And this is one of the things that I'm most excited about and passionate about. So the JED Foundation is a nonprofit out of New York that's focused on preventing suicide and protecting the emotional health of teens. They recently realized that they have a lot of expertise and knowledge, and they wanted to share that on a nationwide level. So they decided to partner with the AASA, the School Superintendents Association. Did I get that right?
That's right.
And they decided to do a district comprehensive approach with a limited number of districts. So we are one of 14 other districts that were selected out of 56 to be part of this initial JED Foundation cohort. So what that involves, and really it has more benefits than I could even possibly list, but the pilot project is really an opportunity for us to receive a 360-degree diagnostic of the mental health structures that we have laid out in our district, receive guidance, best practices, and connect with other district leaders. So some of the things that are happening with that is it kicked off with us establishing our steering committee, who the key players in our district are. Dr. Remucal is one of them.
Not surprised. Good.
And then we had a district mental health specialist that came and did an on-site visit with us and visited each of our schools to just kind of get a feel of what does Minnetonka look like. From there, we completed a self-assessment that looked at all aspects of our district: policy, what supports we have in place for kids, our co-located therapy services. Then we did a principal survey. what do principals see from their lens? We're currently just launched our faculty and staff survey. We're in the midst of that. So to gauge staff's assessment and perception of how things are going in our district. And then what will follow is a student survey at the high school level to say how do students perceive this. So from there, they will take all of this information and really be developing a personalized strategic plan for us here in Minnetonka that will really guide the work, hopefully that the Mental Health Advisory Committee will be part of, and for us as a district to say, what next steps? What will that look like? Where do we need to go from here? So it's really exciting work.
So that's a chance for our district to say, what are we missing in our program, and what do other schools do that might better support students?
Yep, exactly. And some of the 7 different areas that our work will focus on once we get our strategic plan is developing life skills, promoting that social connectedness and positive school climate, which again ties in with those board goals of belonging, encouraging help-seeking behaviors. Who do kids go to if they're struggling in school? Improving recognition and response to signs of distress and risk, and we've already been doing quite a bit around professional development for mental health for our staff. Promoting student access to effective mental health treatment, establishing and following crisis management procedures, which has been a big focus of the district recently, and then promoting mean safety. So it's really a very comprehensive approach to help support our kids in the many areas that they need to help support that mental health piece.
Well, anything to add about the JED Foundation? I know you've been pretty involved with that also.
Yeah, and it's been really exciting to watch this develop and evolve over the course of the past year. I think especially since Minnetonka was already starting to do some of that work even before the pandemic, one of the nice things that we've been able to see is how much that's already paying off, how much that's already fitting into this JED model. I think as one of these 15 school districts, ours included, I think we are finding that we are probably already a little bit ahead of the curve, and so we are probably going to be sharing as much and helping other districts learn from us as much as we are going to be getting back from this program. That being said, one of the really exciting areas is that we are just getting so much more data that's available now, and medicine went through this about 10-15 years ago when the electronic health records came online. Suddenly we had all this data that we could analyze and figure out how we make connections between different things. Education is now kind of in that moment when we are starting to gather a lot of data, and one of the tools that we're hoping to be able to use is, can we take this data that we're seeing, whether it's grades, whether it's absenteeism, factors like that, and see if we can piece together what sort of warning signs can we identify in this data that can help identify those students who are going to be at most need, who might be potentially having a crisis, that we can intervene before that actually develops.
I would also add, I think, thank you for bringing that up. We are comprehensively looking at a district as to how all of those interplay with each other, because we know that kids that are struggling with mental health are often struggling with attendance, they're struggling with academics, they're struggling with those interpersonal relationships. So as a district, we have looked at those early warning signs and what is the threshold for saying, when put together, these kids might be at risk, and we want to intervene before they get to that crisis point. So that is something that's been very intentional with the work of the district too, is to develop those thresholds to say, you know what, let's take a look. Let's make sure that this kiddo has some supports in place. And when we look comprehensively at that big picture of the kiddo and all of those pieces that go into the whole student, that helps to guide our work.
Has your experience been that parents are generally supportive, or are they curious, or wanting more information?
My experience has been that parents want to do whatever they can to help support their kiddo. And a lot of times they don't know what to do, and they're looking for support, they're looking for answers. And so if we can be partners with parents in helping to figure out those resources and solutions, that's really a natural role for the district.
Yeah, and speaking as a board member, speaking with community members, we hear a lot that, when we explain what's going on with the district, especially with this JED Foundation project and some of the other work we're doing with the Mental Health Advisory Committee, a lot of parents are really grateful that it's happening. They don't know that it's going on. We try to talk about it as much as possible through either our board meetings or podcasts like this. We try to get word out there, but so many parents aren't aware of it, and when they become aware of it, they are very grateful that it's happening, and they're very impressed that we are taking such aggressive steps to try to battle this problem.
Well, as we're wrapping up, Is there anything else you think it's important for our community to know about how we are working to improve our ability to meet students where they are and improve their mental health?
Sure. There's so much that we didn't talk about that we're doing in the schools too, that everywhere from our Growing Through Grief to our Grief Sensitive Schools initiative.
Well, let's talk about Growing Through Grief.
Sure.
What is that?
Yeah, so it is a program it is a partnership with Park Nicollet, and it started 27 years ago. We were the first group to say yes.
Wow.
That it's really identifying and acknowledging that most students will have a significant loss in their lifetimes. And how do we support that? Because unsupported grief, again, manifests itself in affected relationships, affected academics. And so really it provides that school-based specialized grief counseling in individual and group therapy sessions when a kid has had a significant loss, and provides death-related crisis support for staff and students in the unexpected or expected event of the loss of a student or staff member. So it's really a wraparound service that looks comprehensively at how do we support kids around grief, around informed supports with teachers, with professional development of how do we support kids that are grieving, and how does that look in the classroom. So really some exciting things happening there too.
Wow. Anything we didn't cover that you've experienced since you've been on the board or with the Mental Health Advisory Committee?
Well, I think we've covered things pretty well. I'm very, very impressed with how much the community of mental health support, both in the school and the providers outside the school, really work together in order to come up with solutions for the students. And I think it's going to be really exciting to see how this JED Foundation project really changes their trajectory, helps us figure things out a little bit more, how to do things a little bit better, and provide the best that we can for our students.
I would also add, I am just grateful for our community providers who step up and step in with us in this work. We are very lucky to have partnerships and organizations that are committed and willing to do the work with us. And I think it's so evident in our Tonka Cares Coalition and our Minnetonka Family Collaborative and the variety of organizations and agencies that are in it doing the work with us. It's really impressive.
Well, last week at our PTO meeting, the Hopkins, and I'm not going to remember the name of the provider, but another group that prioritizes 14 to 26-year-old students and fast service and low-cost service. We have a lot of partners that stand with us to serve the needs of our kids.
Yeah, exactly.
Well, I want to thank you both for giving up an afternoon to inform our community about all the ways we are working to ensure our kids stay healthy, get healthy, and that we can transition them through our system as needed, partnering with other community agencies. And I want to thank you and our community for joining us on this important topic. As Dr. Mike shared, the data shows that this needs to be an area of priority for our school district, and I'm proud of the work that we're doing within our school district to commit to our students' mental health. Thank you for joining us for this podcast. Join us again in the future. We'll see you around.